Welcome to the Embrace Healthcare Plans website. We've seen all the headlines and read all the tweets. The debate over healthcare reform is back. But until now, our options have been limited. Either fix parts of our current dysfunctional system or eliminate private insurance and go for a government-run, single-payer system. Embrace single system healthcare reform offers a third option. It uses well-established concepts from our current and single-payer systems and creates a 21st century infrastructure. Embrace was developed almost 10 years ago by a group of healthcare professionals and continues as an open access project to reform the American healthcare system. Embrace is an acronym for Expanding Medical and Behavioral Resources with Access to Care for Everyone. The following is a short introduction to the plan. Embrace has three major innovations that are designed to work together: an evidence-based tiered benefit structure, a health information platform, and a national medical board. Let's start with the first innovation, the evidence-based tiered benefits. The tiered benefit system is divided into three tiers. Tier 1, basic healthcare benefits, covers conditions determined to be life-threatening, therapies shown to be life-extending, preventative services, and all the workups needed to rule out or rule in Tier 1 conditions. Tier 1 conditions might include heart attacks, cancer therapy, and diabetes care. Tier 2 supplemental healthcare benefits covers conditions and therapies to improve quality of life, as well as therapies for Tier 1 conditions that may not have had enough scientific evidence to be included in Tier 1. Tier 2 conditions might include chronic back pain and knee replacement surgery for osteoarthritis. Tier 3, luxury healthcare, might include cosmetic surgery. The reason why the tiers are separated is because of the way they are covered. Tier 1 coverage is automatic, free, and universal. It covers everyone from cradle to grave, is fully portable from state to state and job to job, and offers full access to every healthcare provider. Tier 2 may be covered by affordable and transparent private insurance. Unlike with the Affordable Care Act, which mandates that everyone be covered by insurance, Embrace will have no mandate to purchase Tier 2 insurance. Because of this, there may be individuals who might have to pay out of pocket for Tier 2 services. Keep in mind that all Tier 1 services for these patients will be covered, and most Tier 2 services would be elective, so paying out of pocket would not burden the patient like it might in our current system. Finally, Tier 3 services will be out of pocket, as is currently the case. The second innovation is the Health Information Platform. It is an internet-like closed network that will be available to every licensed healthcare provider. Every patient encounter will begin with a universal billing form which would act like a homepage. It will use the current well-established coding system and will be linked to the electronic medical records. After the universal billing form is finalized, the information is sent to a central computer that would analyze the data and make an automatic tier allocation. Once the tier is allocated, an immediate payment determination is made. If the encounter is determined to be Tier 1, the provider would be paid immediately. If it is determined to be Tier 2, the computer would search its databanks to see if the patient has Tier 2 private insurance. If the patient has insurance, the insurance company would be billed and the provider paid. If there is no insurance, the patient would be billed and the provider paid. If it is Tier 3, the patient would be billed and, of course, the provider paid. In addition to its billing function, the HIP would also allow rapid accessibility to patient records that are kept in the central computer. This means that any connected healthcare provider would have immediate access to the patient's medical records and to all testing and monitoring. And these would not only be reports of the tests, but also the images and raw data. This would allow the provider to reanalyze the test if needed and maybe avoid the need to repeat the test. The HIP would also offer the opportunity for entrepreneurial application development, similar to how Apple opens its iOS platform to developers. Instead of video games and dating apps, the HIP developers would develop clinical software for electronic medical records, home monitoring, and image readers. The only stipulation would be that all of these software applications would be fully interoperable. The third innovation of Embrace is the National Medical Board. The National Medical Board is modeled after the Federal Reserve Board and would be politically independent, would unify the entire U.S. medical system, and would have a national health care mission to promote the health of all Americans. The National Medical Board would be chaired by a physician with experience in public health and healthcare economics. Like the Federal Reserve, there would be a board of governors with representation from all areas of the healthcare system, including public health, HIP administration, tier system administration, and medical education. An advisory council would allow input from the pharmaceutical industry, device companies, private insurance, business, and other interested parties, yet put a buffer between these special interest groups and the Board of Governors. And since there is significant regional variation in healthcare across the country, the National Medical Board will have regional chapters. Like the Federal Reserve oversees the entire American banking system, the National Medical Board will oversee the entire American healthcare system. It would oversee healthcare access by unifying private and public health insurance, replacing CMS, Indian Healthcare, and the Veterans Administration. It would oversee drugs and devices, replacing the FDA. It would oversee healthcare research, replacing the NIH. It would oversee the HIP's central computer, which would allow it to monitor and manage public health, replacing the CDC. And it would oversee postgraduate medical education, possibly eliminating ACGME and the ABIM. Funding for the National Medical Board would come from one annual congressional bill, instead of the many funding bills that are currently needed. This diagram attempts to capture the complex interaction of our current system. As you can see, there are 3 circles, a green one representing the public healthcare system, run by the Department of Health and Human Services and containing the CDC, NIH, FDA, Medicare, Medicaid, and Indian Healthcare. A blue one representing private insurance containing HMOs, CINs, EPOs, PPOs, and the healthcare exchanges, and a red circle representing the relatively independent VA. What can also be seen is the chaotic interactions that have developed between the private and public systems. More than half of Medicare and Medicaid have become privatized, while HMOs have started to include Medicare and Medicaid patients. And with the ACA, many private insurance plans obtained from the healthcare exchanges are publicly subsidized. And yet, this diagram is an oversimplification. A couple of years ago, the Senate Joint Economic Committee released this chart of our healthcare system. Although it was a partisan attempt by the Republican members of the committee to mock the Affordable Care Act, it does make the point that the American healthcare system is very complex, even chaotic. And it also begs the question, if you want to reform this system, where do you start? Do you pick 1, 2, or 3 areas to reform, as most attempts at healthcare reform have done until now, and hope your actions will cause the right combination of interactions to affect the right results? Or do you completely replace it and rebuild it from the ground up? And if we decide to completely replace a system, what do we replace it with? The answer, we believe, is represented by this diagram. It shows how Embrace would consolidate the chaotic and archaic healthcare structure we have today under a single system healthcare system. Notice that the National Medical Board will have control over the entire healthcare system, including the tier system of public and private insurance, medical research, the health information platform, drugs and devices, and postgraduate medical education. The creation of a single system healthcare system will offer many advantages to many different groups. This includes patients, healthcare professionals, public health, government, hospitals, businesses, and even private insurance companies. In this introduction, we will review these 4 groups: patients, healthcare professionals, public health, and government. Patients and consumers of healthcare would see tremendous advantages under Embrace. It is specifically designed to be user-friendly and affordable. In fact, Tier 1 services would be free and everyone would be covered automatically. This automatic inclusion into Tier 1 means that there would be no enrollment requirements, like it is under the individual mandate of the Affordable Care Act. Everyone would be covered from cradle to grave, job to job, and state to state. It will cover all emergencies and preventive care, and there would be no out-of-pocket fees, such as annual fees, deductibles, copays, or penalties for seeing a doctor or going to a hospital outside the insurance company's network. Tier 2 coverage by private insurance would be affordable and transparent due to the way it would be formulated and offered. These Tier 2 plans would be formulated by the National Medical Board to meet general Tier 2 needs as well as the needs of various consumer groups such as elder care, veterans, and even for workmen's compensation. These insurance plans would be offered to the consumer in a menu similar to the Medigap menu. Currently, when Medicare consumers want to purchase Medigap supplemental insurance to cover what regular Medicare does not cover, they first encounter this menu of Medigap private insurance plans. there are 10 columns of choices A through N. If they want a full service plan with all the bells and whistles, they might choose Plan F, which provides all of the benefits. If they want a more basic plan, they might choose Plan A or Plan K. Once consumers find the plan that is best for their needs, they are guided to another menu that provides information on which private insurance companies offer that plan, what extras the plan may include, and the price. This system allows for a more transparent method of choosing private insurance than the healthcare exchanges offered under the Affordable Care Act, and it allows for better price comparisons. Embrace would offer a similar method of buying Tier 2 insurance, but Embrace would have different choices in the column on the left that are specific for Tier 2 services. For healthcare professionals, Embrace would also offer many advantages over the current system. It will create a science-based system run by healthcare professionals rather than lawmakers and insurance companies. It will eliminate or greatly reduce administrative overhead, especially when dealing with insurance. Because of these reduced administrative chores, it will allow more time for clinical practice. It will provide instant credit for most services rendered. It will enable easy and inexpensive integration of EMRs into practice. It will allow healthcare providers to gain easy access to patients' medical records and testing. And it will seamlessly integrate continuing medical education and maintenance of board certification into clinical practice. The creation of a single system healthcare system under Embrace would have a profound effect on the American public health. It will construct an infrastructure designed to take advantage of 21st century technology and innovation, and provide truly universal health insurance coverage. Since it would be run by healthcare professionals, it will have an independent national medical board that would be guided by a national healthcare mission, provide representation from all aspects of the healthcare system, establish a mechanism for guideline-driven clinical practice, integrate healthcare research with healthcare delivery by commissioning studies specifically for guideline development and focusing on optimizing tier assignments, which would be more clinically relevant. Embrace will also facilitate a greater focus on prevention. And because of the health information platform infrastructure, it would allow for universal registries with little effort or expense, provide a mechanism to automatically perform Phase 4 studies on all drugs and devices, which is currently expensive and unreliable, and enable immediate identification of outbreaks and epidemics, much faster than is currently possible. And finally, let's look at the advantages of Embrace for government. After all, unless lawmakers find benefits, it is unlikely that they would be interested in promoting the plan. Embrace would offer a bipartisan method to accomplish truly universal coverage for basic healthcare services. It will check, or more likely reduce, public healthcare expenditures both for federal and state governments. In fact, since states would not have to fund Medicaid and most of the state's government's employees would have Tier 1 coverage, it would virtually eliminate healthcare spending by the states. Embrace would eliminate healthcare-related federal agencies such as HHS and the VA. It would stop the impending bankruptcy of the Medicare Trust Fund, which is now projected to occur in 2028. It would eliminate the individual mandate to buy private health insurance, a very controversial part of the Affordable Care Act, and it would eliminate the business mandate to provide employees with health insurance, another controversial requirement in the Affordable Care Act for large companies. This was a very brief introduction to Embrace. If you are interested in learning more about the plan and how it would affect various groups, or how it differs from our current system and single-payer systems, please read Embrace, a revolutionary new healthcare system for the 21st century. It is available on Amazon and on Kindle.